everyone, welcome to Nursing Wisdom. Let's move towards the topic called asthma. Asthma is a chronic inflammatory disease of the airways characterized by the hyperresponsiveness, mucosal edema, and mucosal production, in which it is one of the respiratory condition in which airways get swollen and there will be a production of mucus which leads to the difficulty in breathing so that the person cannot breathe. If the person breathes, there will be a wheezing sound during breathing in which if the person is under asthma condition. It is a chronic lung disease that inflames and narrow airways so that the person cannot breathe properly. There are a lot of types of asthmas like allergic asthma. This is caused due to the inhalation of allergens like dust, pollens, etc. Exercise induced asthma due to the asthma is the condition in which it is due to the exercise, and cough variant asthma. Next one, occupational asthma. It is the asthma due to the occupation in which several people work in the several places like industries so that they can get asthma condition due to their occupation. Next one is the nocturnal asthma, childhood asthma, and stress asthma. Stress asthma is due to the several emotions. Next, let's move towards the causes. There are a lot of causes which leads to the asthma conditions like allergens. Allergens like inhalation of pollens, dust, animal dander, cockroach allergens. And some people, if the person is having the allergy in the shellfish, so that there are the chances of leading towards the asthma conditions. And due to the tobacco smoke like primary or secondary, because of the smoke, the person get asthma easily. And due to the exercise, already I have explained about the exercise induced asthma. Due to the exercise, there are chances of the person is moving towards the asthma conditions. And some of the weather like cold air, wind, rain, and sudden changes in the weather which can bring on asthma episode. And medications, there are a lot of medications which move towards the asthma. Next one is the air pollutants and irritants like the fumes, aerosol sprays and perfumes, and there are respiratory tract infections, also flu and common cold, and sinusitis, some of the emotional stress also. It is called stress asthma, and gastroesophageal reflux disease through the trachea, and some of the occupational exposures like chemicals and irritants. I hope you understood the etiology of the asthma. Let's move towards the symptoms. Symptoms are usually like shortness of breath, and the person will be having the feeling of tightness in the chest or a feeling of pain in the chest. And if the person is while breathing, he is feeling a wheezing sound during breathing, and there will be a trouble in sleeping or insomnia because of the shortness of the breath. The person cannot sleep properly, and there will be a coughing or wheezing attacks because by a respiratory virus such as the cold or the flu. Let's move towards the pathophysiology. Here you can see the pathophysiology. Trigger factors are such as the etiologies. I have already explained so many of etiologies. Due to these etiological factors, there will be the inflammation in the airway in the person. So that the inflammation airway will lead to the hypersecretion, like there will be a hyperproduction of the mucus, and also there will be the constriction in the muscles in the airways, and also there will be the bronchial membranes will get the swollen. All these three together will lead to the narrow breathing passages so that the person cannot breathe properly. There will be the shortness of breath in the person, and he will be having the cough, and he will be having a presence of tightness feeling in the chest, and he will be having the pain also. And all the important thing is he will be having a wheezing sound during breathing. Here you can see in the diagram that this is the normal airway in which it is the mucus. It is a normal airway in the person. When the person undergoes the asthma condition, there will be the mucus production. This is the mucus production, and when the asthma attacks in the person, there will be a narrow pathway in this airway so that the person cannot breathe properly. There will be a tightness feeling in the chest. There will be a wheezing sound. Next, let's move towards the management. The person's will be having the cause, So that the nurse first manage of the nurse is to identify the cause and lifestyle modifications and pharmacological management such as to provide the bronchodilators, corticosteroids such as prednisone, hydrocortisone. There are the nursing diagnoses such as ineffective breathing clearance related to bronchospasm, ineffective breathing pattern related to presence of mucus in the airway and narrowing of the airway, impaired gas exchange related to decreased amount of air during ventilation, activity intolerance related to inadequate oxygen in supply. These are all the nursing diagnosis of the asthma. I hope that you got the asthma topic in this video. This is my first video of my channel. If you like the video, please encourage me so that I can move towards so many topics. Thank you.